I would take a couple months break at this point.
Couple months. Oh, I'm happy.
Yeah, I mean, I like let your body rest and repair.
Okay.
Generally, when we're doing like ozone at the clinic and stuff like that, your body continues to repair for a period of time after the therapy has been delivered. So we want to give that time for your body to kind of catch up to it and that sort of thing. So
you put ozone in the chamber too?
no, two different therapies. Don't do that.
I was gonna say.
No, don't do that. No, we're not doing that.
Okay.
All right, welcome to the podcast. Today we are going to be talking about the science and benefits of hyperbaric chambers. Today we have two guests with us. We have Dr. Stephanie Coxon, who owns O2 Hyperbarics, and we have my dad, Bob Weaver, who actually built his own hyperbaric chamber. So we are going to talk about the two sides of what that looks like today. And just a little background on why I'm interested in hyperbaric chambers is many years ago, I've been traveling to Salt Lake City. I went to Snowbird in Utah, and the elevation there is extremely high. And when I go there, I get extreme elevation sickness and altitude sickness, and it is not fun. Vomiting, like it got really bad when I was in Snowbird. So I started to research different ways to alleviate those symptoms whenever I do travel. And I found that hyperbaric chambers was one of the options. So I guess when we're at sea level, there's like 21% available oxygen. But then when you go to like 5,000 feet above sea level, it's only like 16%.
And it reduces as you go up. Yeah.
So that's why I guess I struggle. And I guess some people are more susceptible. So that was really the reason why I looked into hyperbaric chamber use. And then since then, Dad decided to build one. We have a lot of autoimmune disease in our family. There's a lot of anti-aging, longevity benefits. There's so many things that we're going to talk about today. So I'm really excited to just learn more and to maybe start utilizing it a little bit more in my own life. But we're going to start with Steph, and Dr. Steph Coxon. She owns O2 Hyperbarics, and she is really, I think, the only one in Central PA that has units that we can use besides hospitals, which are going to be more for the medical grade use.
Right.
Right.
Yeah.
So do you want to dive into like the science and really the background, hard versus soft?
Yeah. Well, I tell you what, a lot of people don't realize that these chambers have been around since the 1700s. I know people don't realize. So it was like a British physician, I think, who first started it and realized by adding a little bit of pressure, and it doesn't have to be much actually, that you can actually drive the oxygen into the tissues, because that's really where the miracle happens, is getting it out of the blood plasma and into the tissues for their regeneration. And so it's been around for a long time. It is extremely safe at different pressures, but there are differences between hard and soft shelled chambers, and there's risks and there's benefits to both of them. So in our clinic, we tend to do the soft shelled chamber just from a safety standpoint. So, when you look at the soft-shelled chambers, you don't have the higher pressure. However, in most circumstances, you actually don't need the higher pressure. And those higher pressures come with bigger risks that we're just simply not willing to take. And part of that is just making sure that our clientele stays very safe, but also getting the benefit of it. And so what people will typically see from doing hyperbarics is just a reduction in overall inflammation and an increase in oxygen utilization. So one of the things that happens as we age is there is that reduction of oxygen utilization, and that's really the aging process. So if we're able to take the oxygen and get it pushed into the tissues, all of a sudden we see miracles happen, like more BDNF in your brain, and we see that inflammation go down, and we see things happen where there are new capillaries that are formed. And so that's what begins to happen in the body.
Yeah. So like you just mentioned the blood capillaries. So like, is that angiogenesis? That's the new formation of like blood, right?
Yes. Yeah. And so, out of the blood vessels, you get the capillaries. And so that impacts your like circulation and different things. So, what happens, and it's interesting. So one of the things you can tell is if you look at your nails, you should have half moons in all of your nails except for your pinkies. And that really will show two things, depending on who you look or who you kind of believe. I don't know if you say believe, but it impacts your circulation and your thyroid. Those are just like a marker that you will see through Chinese medicine as a signaling that your body signals everything that happens, right? So I tell people that when someone goes out and they've been drinking all night and you look at them the next day, they look different. You're like, wow, you've had a really rough night, right? So our bodies signal everything that we do in some way. And so we can look at the signaling, this outward signaling, to understand what's happening. So one of the things you can do is look at your fingernails and see how is your circulation, how is your thyroid health? And that's going to be part of that kind of tool. I would pair it with blood work or something like that. But it's just like part of that signaling that you'll see first and foremost before anything else, before even a blood test will happen, things will start to diminish. And so that's some of the stuff that you can kind of look at outwardly and understand what is the impact on the system.
Okay. So a lot of people are asking, like, well, would hyperbaric chamber use help me? Do I have can we kind of talk about like an acute injury, like a TBI, a stroke, concussion, athlete injuries? Like, who might need to seek that type of therapy?
So, I mean, it's kind of a broad base, and I think that almost anyone can benefit from it. Now, there are contraindications. So, if you have COPD, for example, it's not the right therapy for you. But if you look, for example, at a stroke victim, it does not increase survival rate, which I have my own theory on that, but it does help with the impaired cognition. So there's I think it was a meta-analysis that was done that showed that increase in cognition after a stroke, but what didn't change was the survival rate, and that was done, I think, in a retrospective study. So there's still a benefit because you're getting a better quality of life while you're here. When it comes to brain injuries, that's actually why I got into hyperbarics. I had a son who had concussions. He was a top athlete, top student. Got, I guess it was his third concussion, and we had to keep him home from school. He couldn't go to school. He was just so confused, the headaches, just could not make it through the day. And so, like most parents, I think you research, okay, how do I fix my kid? And it turned out that hyperbarics was the way to do it. And so that's actually how I first dove in, is to help heal his concussion. So he went from not being able to go to school. He did go to college, really struggled his first semester. He came home, we did hyperbaric sessions, and all of a sudden he didn't have the headaches anymore. We were able to reduce his tremors. He was able to concentrate and focus, and has just done amazing using the therapy. And as a matter of fact, he's got one in his house now because it's that big of a deal on the progress that he has made with it.
Wow. Well, and concussions are such a huge problem with student athletes. You hear about it all the time.
Well, I think part of the issue that people don't understand are these kids are walking in with what I would call a chemical concussion, right? So these food dyes, these seed oils, everything in our foods that these kids are typically eating, that's inflaming their brains. They're walking around with an inflamed brain. So it doesn't take much with an inflamed brain to go into a situation, get a little knock on the head, and all of a sudden we have a concussion. So it's not just the sports. And so, your football, your soccer, those definitely cause a lot of concussions. But I would say that the number one thing that you need to do to prevent those on the field was actually get the diet in check. Nutrition is absolutely huge for that, because if your brain's not inflamed, it's going to be much harder to actually get that concussion.
Right. Well, that brings us to a good point. So we can't really just utilize hyperbaric chamber use and think it's going to fix our Lyme disease or our autoimmune disease, right? While it can help, we need to have the proper nutrients, right? We need to have the proper foundation for it to really work to its best capacity, right?
Oh, yeah, absolutely. Like anything else in life, we get to these disease states because of our lifestyle. If we don't change the lifestyle, we'll end up back at these disease states that started that progress in the first place. So you can absolutely use any therapy really to help your body get into that homeostasis where it's able to fix itself. But you've got to change the lifestyle that got you there, to start. And so, let's say you're dealing with cancer or something like that. Part of that is your metabolic rate, right? And so you might want to go more towards like a ketogenic diet as you're battling it, while doing hyperbarics and maybe vitamin C or whatever else you may want to do along those lines to help support your system as you're going through that journey. But that might not be the case for someone, let's say, with ADD, ADHD. you're going to be way more focused on the food dyes. You're going to be way more focused on the additives, right? So it's going to vary person to person. And even in that, there's going to be some people that you may want to increase oxygen even further. Like one of my favorite little tricks is frankincense and balance, because it actually increases the red blood cells. And so that can be amazing add-on when you're going into a hyperbaric chamber. For someone else, we may do like dimethylglycine, DMG, and pair that with maybe some peppermint to increase the oxygen levels. So they're giving even more oxygen without the higher pressure. So it's a lot safer. We even use a inhale hydration water drink that increases your oxygen levels. So we'll pair things up together to help people get the most out of their sessions.
Yeah. Yeah, that's fascinating. I forgot about the benefit, with Frank.
Yeah.
Balance, increasing that. Yeah, and then I heard like
Amazing if you're traveling to higher altitude. Like you should keep that on hand. Yeah.
do that. Yeah, and then I heard like after your session, you have like 30 minutes where like if you went on a run or you did something, you would have higher performance, right?
Yeah, I think yes, and I think it's probably a little bit longer than that. I'm not exactly sure, but there's definitely a performance factor to it. And so when you think of performance, you're creating micro injuries whenever you're doing a sport or anything like that. This speeds up the recovery. So that's really what it's doing. That oxygen just speeds up that recovery, and so that's why your performance levels elevate.
Okay. Let's switch over to more like chronic conditions. So that would be like our Lyme, like autoimmune, and like Dad has some neuropathy and things like that. So for like our chronic issues, you probably need more sessions, right?
Yes. Yeah. So the more chronic something is, so if someone comes in and says, "Hey, I had a concussion today," you could probably get in the chamber a couple times and be done. If you're talking about a TBI that's been there for 10 years, you're definitely going to need more sessions to get through it. The same thing is true with an autoimmune issue. It didn't build overnight. Usually it takes years and years and years to get to that point. And so it does take more sessions to help your body. I think we had a guy with MS who came in, and I think his final session was like 62. Yeah, it was significant. And so there's definitely a correlation between the disease and the amount of time that you need to get in there. Generally, the first people to feel a difference are going to be your brain injury people. Then after that, the autoimmune, I think a lot of them start to notice a difference around 10 sessions. So it's a lot of work. It's not like a one and done thing. It's an investment in your health. It's an investment with your time. You really have to look at the long-term road of why are you using this. But, again, pairing that with some other healing modalities, phenomenal in order to get your health back and where you want to be.
Yeah. No, that's a good point. I think with those chronic conditions, maybe like our listeners are not realizing that it is an investment of time. And that's why some people will have a unit at home like Dad did. And we'll talk just a little bit more about that soon. But I do want to just talk a little bit about the anti-aging benefits. So I know this is always where I go. So I'm trying to defy age as long as I can. So obviously, we do want to live longer and healthier. I want to do that so that I can play with my grandkids and be around for them. But looking at the vein side of things a little bit, it is supposed to help with wrinkles, fine lines. And then so I know there was a study done where they looked at people that were above 60 years of age. And I think they looked at their zombie cells, which I was just learning about.
Yeah.
Senescites or something they used to
Senescent. Yeah, senescent cells, yeah.
And then their telomeres, which is the little, I always think of a shoelace, the little caps on the end of our chromosomes, right?
Yeah.
Shorten. But from what I understood, and you can elaborate on this, there's no therapy out there that decreases the zombie cells like hyperbaric chamber use, and then also reduces the zombie cells and increases our telomere length. So we want to increase that. We don't want those to shorten.
Right. And I can't say there's not another one out there that doesn't do it, but you're absolutely right. They increased, I'm referencing the study that you're talking about, those above the age of 64 had a 20 to 38% increase in their telomere length. And that is one of the biggest biomarkers of your health. right? So the longer those are, so that's pretty significant because, we stop producing stem cells around 40, right? You see, in some studies, they've shown up to an 800% increase in stem cells, even using hyperbarics. Yeah, like it's phenomenal. Yeah, and so those senescent cells or those zombie cells that you're talking about, that's our body. Like they don't want to let they're damaged cells that our bodies don't want to let go. So they start to create more damaged cells, and we don't really want that. So if we can reduce that and then get that telomere length up all in the same time, that's pretty phenomenal. I mean, that's the huge anti-aging hack right there, right? And then to get stem cell production, I mean, you can't beat that. But let me tell you, when it comes to water, I mean, I hate wrinkles. I like this is the number one wrinkle remedy, honestly, is water. People need to hydrate, and so I would love to say that the hyperbarics could get rid of wrinkles. Like, but honestly, water is your number one thing for that. Now, if you want pretty telomeres and lengthened telomeres, HBOT's the way to go.
Yeah. And I think there's been a lot of research done on epigenetics, right? So we have our DNA, but then the way that those DNAs they play out.
So think about light switches, right?
Yeah.
We turn on the light switches, we turn off the light switches. So everything that we do in life is going to do that. I come from a family where everyone, I mean, literally all the females have autoimmune issues. It's kind of crazy. I've got 2 aunts with MS. My sister has lupus, and I'm well into my late 40s, and I don't have any of that. I have I function like I'm in my 30s. And so that's all lifestyle. There's no miracle drug that fixes that. It's simply me choosing not to eat the piece of cake, or me choosing to eat the right food without all the extra additives and stuff like that. We combine a healthy lifestyle with some of these therapies, and you've got magic. And that it changes the whole function of your life.
Yeah. Yeah. All right. So let's switch gears to Dad. So we are not recommending that everyone take this route, but Dad, you have sort of autoimmune stuff going on, some neuropathy, and just really needed, you've researched a lot, you've done a lot of things to improve your health, but you needed a unit at home because you use it. You'll have to tell them your protocol. But yeah, tell them first what you built, maybe a little bit about how you built it, how you figured out how to build it. So, but I do have to say this before we go there. So his youngest granddaughter, Danela, who's my daughter, when she found out that you were building the hyperbaric chamber, she said, "Oh, Mom, you cannot let Pop get into that. He's going to turn up. We're going to find him out there as a shriveled up prune in that." She was like, "You cannot let him do that." And I said, if we tell Pop not to do something, he's going to do it. So I've grown up with my dad. Anybody tells him he can't do something, he figures it out. He lets it work. He can build everything. He fixes everything for me, So in my eyes, he's a hero. But he has built this hyperbaric chamber. The only other person who's gotten it is my husband, Nick, not so far. Yep. But tell them what materials you used, how you figured it out, what research you did.
Well, I found an old nitrogen tank that wasn't used anymore, and they're clean, so I didn't have to do that. And I cut the end of it out and made a door frame, and there's a fellow online. I can't even think of his name right now, but he does this. And he built one for on board a ship, and that's what I copied, his design. And I got most of my ideas, what for glass to use for the windows and that kind of thing. And then the pressures and stuff, he just said what to do that way, and I just talked to other people, and Steph said to do 1-3. I checked it. It's good to about 4 atmospheres. I took it that high in pressure whenever I first tried it, just to make sure it held air and everything. And then, but I get in at 1.3, 1.4 now all the time, and I get in 10 days on and 5 days off. That's what Steph told me to do. Yeah. And I don't use any oxygen or any oxyconcentrator. I just used air.
Pressure.
Yep, just air. Yep.
Yeah. Can you help us understand because I don't know what he means. Like, how far would he be going down underwater? At 4. Is that what it was? Did he say 4?
No, 1.3 is generally 1.3, 1.4.
So So around two, you're looking at probably like 33 feet, about 10 meters.
10 liters, yep.
Yeah. So that's what you're looking at there. And no one really should be doing 4. I mean, and you were
No, I wasn't doing 4. No.
2 is probably the most common in the hard chambers. Sometimes 2.5. It'd be very isolated situations when you would want to go above that. And there are dangers that come in at that point. So I don't really recommend, without a doctor supervision, going to that, because that's when you get into kind of the issues where it can become dangerous. Someone can have a seizure, that sort of thing. When you're staying around the 1.3 to 1.4, it's very safe. And so you don't have to worry about the side effects as much. It's very difficult to run into that. But yet, the research has shown that while it may take longer to get to the point that you need, you do it very safely, and you get to the same point as if you're using the 2.0 atmospheric pressure, atmospheres.
Okay. So when you jump in that thing, how long is it from start to finish?
It's about an hour and 20 minutes. Because I bring the pressure up slow till I get up to where I need to be. And then when I'm done, after an hour of that, then I start bleeding off, and it takes 7 minutes. For me to get out.
Just letting the pressure off.
Well, when I built it, I drilled orifices, so I can, and they're timed for what pressure I'm at. So I have a valve that I open up for that, and it takes 7 minutes to bleed. You just sit back and wait, because you can't open the door.
Right. It wouldn't let you.
You cannot open the door. No man can open the door. A lot of pressure in there, really, per square inch. Yeah.
What have you noticed? So you said you do it 10 days on, 5 days off.
Yep.
So I'm just going to pause there. So it's actually not healthy to do it and not give yourself a break, right?
Yeah, almost in most healing modalities, you want to give your body a break to recover, right? So it's going to be the same thing here. You can over-oxygenate your body. So that's what you really want to avoid. So you want to give it enough to where it can recover, give it a break, come back, get to it again.
Right. So is that oxidative stress that you're putting on the body a little bit? Like, it's kind of like the healthy stress on your body, and then your body repairs. So you need like the antioxidants to kind of build repair.
Yeah, but no, you can also overdo antioxidants. Like you do have to be somewhat aware of going overboard with anything, right? More is rarely better. You want to get to a certain point, but your body needs the rest state. It knows what to do. Our bodies are amazing. They're designed to survive, right? The reason our bodies go off is because your body is designed to put you in survival mode. So when one thing goes off, it knows that, okay, we need a little bit more of this to help you along, to keep you living. So it's so that you're functional. And so we have to give to account that the body knows the repair process and give it its time to do its thing.
Yeah. Okay, great. All right, so back to Dad. So you do 10 days on,
Yep.
5 days off.
Yep.
Have you changed that schedule at all?
Nope, because I haven't talked to Steph. That's the only reason.
Yeah.
And I logged about 80 hours in there. 80 sessions.
Yeah, and I would say we do want to take longer breaks as well.
Okay.
Yeah, so we do want to make sure that here's the thing, we need to be disruptive to our bodies, right? Because our bodies learn our habits and everything else.
Oh.
And so we do want to take longer breaks from it, especially when we're at that many sessions.
Okay.
And which we could talk later.
Yeah.
But the idea is that we don't want our bodies to catch on to what we're doing. We need to rest. We need to keep tricking it. Yes. Even with your diet and everything else, you need to trick it. You need to have a bad day, even if you're really good the rest of the days. You've got to trick that body.
Okay. So what have you noticed? So we were talking about like chronic issues. It takes a lot longer to see benefits. I hope to be like you when I'm your age.
I hope you're a lot better than me.
Okay.
But
you your horse and you're working.
I don't take prednisone anymore at all.
So that was something that they continued because your blood pressure would get so high.
Yeah. Yep. I had all kind of trouble, and that stuff there has its own problems. Mm-hmm. So I already had cataracts because of all them. So
you've been able to not take prednisone?
I don't take prednisone anymore at all. My blood pressure's better than it's ever been.
Okay.
For I don't know, 15 years or something like that.
Oh, I know. I
Yeah.
remember we would always worry that blood pressure was always
Yeah.
going crazy.
Yeah.
So how about like your pain level? Because I know you kind of have that neuropathy.
It's helped that, but it's still there.
Still there.
Yeah, it's still there. I mean, when I still work a lot, so when I'm on my feet on concrete, it bothers my feet. But I still take gabapentin, but I don't take much at all. Very little, just before I go to bed.
Okay. So
And I'll start to get rid of that here. I already got rid of some of my blood pressure medicine, so.
And again, we don't recommend you just stop.
No. Yeah. Talk with your doctor.
Doctor. But Dad is a very self-reliant man, and he still talk to doctors, but you know, I home birth babies. I'm all about it too. I think I got it, honestly. But so you've reduced pain or reduced medicines, which is helping your body.
Yep.
Little better quality of life, would you say? We feel
Oh,
quality of life is better.
I can walk up the side of a mountain now, and I don't run out of air anymore. I mean, I can go now.
Yeah.
It would kind of take me a while. I mean, I could do it, but I'd be huffing. My mouth don't even come open. So
That's probably one of the biggest things is the absorption from your lungs and how your lungs are impacted by it. So it makes a lot of sense.
Yep.
Yeah.
Yep.
So more red blood cells, more hemoglobin
Yeah.
available. Oxygen. That's kind of how that's working. Okay. Oh, so I'm going to actually ask more of a personal question. So why are some people prone to altitude elevation sensitivity than others? Like, do you know why? Is there an actual medical reason, or have less red blood cells? I don't know.
That's a great question. So, I mean, you can have unhealthy amount of red blood cells, but I would actually say probably one of the biggest things is dehydration. Most people are walking around dehydrated, and that plays a big role. Not necessarily the reason for everybody, but I'd probably say if I could pinpoint, one reason, that's probably one of the biggest ones.
Okay. Well, that's good to know. And there are times that I'll go to Salt Lake City and I won't have a problem. So maybe it is something like that, but more times than not, I will at least suffer some. But okay, so back to Dad's. So, well, since we have you here, we might as well ask the question. So if he's chronic issue, 80 sessions, you said you'll switch it up now. So
yeah, so I would take a couple months break at this point.
Couple months. Oh, I'm happy.
Yeah, I mean, I like let your body rest and repair.
Okay.
Generally, when we're doing like ozone at the clinic and stuff like that, your body continues to repair for a period of time after the therapy has been delivered. So we want to give that time for your body to kind of catch up to it and that sort of thing. So I would take a little bit of a break after 80 sessions.
So you put ozone in the chamber too?
No, two different therapies. Don't do that.
I was going to say, you
don't do that. No, we're not doing that.
Okay. I didn't know. That's what I thought you meant when you said that.
No, just
Well, how do you do ozone? Well, you got a tent you get in or what?
no. So we actually in the clinic we'll pull the blood out and we run it through UV lights and we ozonate the blood that we put it back in. It's
Wow.
yeah.
you need to go get a hit of that.
Oh no. No. No, I'm good with what I got. I'm good.
Oh, I know. I'm so glad you're feeling better. So the chambers are more readily available for people at home use. I mean, not everyone is going to build their own,
Right.
but there are and you would recommend a soft.
Yeah, the soft chambers are much better. I would only there's only 3 brands that are FDA cleared in the US, and I'm not a huge FDA fan, but there are reasons that you want to make sure you stick to certain ones like we only use OxyHealth and Summit to the C. The reason for that is because they test the PSI to 6.6 before it's ever shipped out, but it also has to go through the like a destructive mode. So it goes to 3 times the pressure to make sure that it's not going to blow up on someone. When you're getting one of those cheap chambers from China that are white labeled or whatever else, you don't know what the safety level is, and you can run into issues even with the soft chambers. And so, doing a reputable company that is manufactured in the U.S. in this particular case, who are running those numbers to make sure you're getting what you say you're getting, are very important for you to get results.
Yeah. Okay. So So DAS is a hard chamber, right?
Mhm.
Because that's how it is. So what would be, so his just can go higher pressure? Is that what that means basically? But he doesn't really utilize it to
Yeah,
that degree?
yeah, and I don't know what the legalities
Yeah.
are in terms of building
Oh,
your
yeah.
own, you know, that sort of thing. So I don't necessarily recommend it because I think there are some legalities
Right.
around that. But yeah, with with the hard chambers, you can go to a higher pressure. You just do want to be like super careful.
Oh yeah, I'm not doing it. I'm good.
Yeah. It
I'm
sounds like you don't even need to do it. It sounded like just do a little more sessions and you
Right.
still.
Yeah, you're still gonna get there. Yeah.
Yeah. Um, so probably for most people, they aren't just going to buy their own hyperbaric chamber and bring it to their house until they've had some experience with it. So
I would definitely get some experience with it because you want to know, first of all, can your ears handle it?
yeah,
Not everyone has good ears, right? And so some people get clogged ears and stuff like that. There are side effects that can happen. So you want to make sure that if you're going to invest that sort of money, because it's going to be between like $10,000 to $30,000 to have one in your house, you got to make sure you can use it and use it pretty easily and functionally. So you do want to test it out, get to know it, get a comfort level with it before you put it in your house, in my opinion.
right. No, absolutely. Can you explain to our listeners, so you're in Central PA, maybe how they could get in contact with you, how they could reach out and set up a session,
Yeah.
your practice, maybe. Yeah.
So our website is being revised right now, but it's getyouroxygenon.com. Or probably the easiest way is to call us,
Yeah.
which is 717-961-6724. That's the two biggest ways. Or you can email us at info@getyouroxygenon.com. So all three of those methods will get to us, but the easiest way is to call us. We can walk you through the process. We do have to have you see a nurse practitioner or a nurse to just do a physical, make sure you can handle it. I mean, there are things that you have to do to make sure it is safe for you. It is not safe for every person.
Absolutely. Yeah. No, I think this was a fascinating conversation, and I feel like a lot of people could utilize this therapy as a complementary therapy to medicine or just for so many reasons.
One of my favorites. Like it honestly is because the shift in health is so huge with it. Not only with anti-aging, but with recovery. I'll never forget I ran like a half marathon, and typically you're a little sore after you run a half marathon. I hopped in the chamber, I had zero soreness.
Wow.
Yeah, it was just awesome.
Well, inflammation is the root cause of all disease, and I know that I am a little more susceptible. We carry, well, somehow, I don't know if it was you or mom who gave me the MTHFR gene mutation, but someone gave it to me. So
Yeah.
I tend to not detoxify as easily as some other people, but it would be helpful for those that carry that gene mutation, right?
Oh, absolutely. Yeah. But a bigger thing is food, right?
Yeah.
The bigger thing is food. But yeah, absolutely. It does help with that because your body does need some extra support that others perhaps don't need in order to reach the same health level.
Yeah, yeah. And so there was one other thing that we were talking about, like with angiogenesis and increasing the blood vessels and brain. So some of the I think it was the Israelis that did a ton of studies on the angiogenesis benefits and the brain, and they studied the brain and the heart, and they also studied the groin. And I know this is such a funny conversation with my dad in here, but one thing that they were talking about was erectile dysfunction, and that is something that a lot of men struggle with. So,
Well,
that is going to increase.
yeah. Well, it's related. Yeah, I was going to say it's related to circulation and all that
Right.
kind of stuff. So absolutely, you're going to see the benefit of that.
Yeah, and so I think his name was Dr. Scott Schur or something, who does he talks about it and shows these slides and MRI studies that he did. But yeah, on the heart especially. So that's such a crucial part to have good circulation in there and the brain. And so, yeah, our entire bodies would benefit from it. So yeah.
Yeah.
But yeah, any additional thoughts on anything for our listeners to share from
Well,
either one of you?
I would just say that prevention is much easier than a cure. And so if you can stay on top of your health now, it will pay off in the long run. So yes, it takes a little extra money now, but imagine all the costs you'll save in the end. And that's huge. And so little things now will lead to big things later on. And so just think about you've got to invest in your health in order to be that grandma who's able to chase after their grandchildren, right? But now's the time to do it. The earlier you do it, the easier it is. The more you're going to prevent, the less disease you're going to have, the better life you're going to live.
Right. And we're not saying just hyperbaric chamber therapy use is going to cure you. There's a lot.
Oh, there's a lot of things. Yeah, absolutely. I mean, everything that you do, even just getting out the fragrances and switching to, oils are going to make a big impact on your health. It's those little things that are happening every single day that are going to make the biggest shift long term.
Yeah. Yeah. So, Dad, do you think some people should dive into a chamber?
Oh, yeah, I think they should. But before I got in mine, I had it built and I was wanting to get in it. Yeah. But your mother wouldn't let me do it until I went and seen Steph and got in hers. Yeah. And then I did get in. But it does bother your ears if you've never done it before. Yeah. If somebody decides to do it, your ears are going to bother you a little bit when you first do it.
Yeah, everyone.
But it gets better.
Like you're going up a mountain and you gotta open your mouth.
Yeah, it's that, but there is some pain. I mean, it does hurt a little bit. Yeah. But it goes away.
And that's not true for everyone. It can vary person to person. Yeah. There is something called earplane ears they can pick up at your local Rite Aid or something like that. That can help with that pressurization that happens.
Okay. Yeah.
Airplane ears.
Yeah. I should have said something.
I'm learning all kinds of stuff.
Little babies scream on the planes when they're pressure. It hurts. So you have to give them a bottle or nurse or a pacifier or something helps. So one question. So I've been in your one soft bed, and I actually got in post-COVID, which is actually when a lot of hyperbaric use became popular.
It's huge for COVID. Yeah.
It's so good for long COVID problems. Yeah, I think they were utilizing it during COVID for acute COVID patients as well. But I got in, and after I had COVID, I did have a lower lung capacity, and I also had a lot of anxiety. And I got in there, and I've never been afraid of closed spaces, never been claustrophobic. And I got in there, and I remember telling Tammy, I'm like, you got to get me out of here. I freaked. But you guys also have a larger unit now?
Yes. Yeah.
So I'm excited about that.
Yeah.
So I don't have to be in a closed space because I could just imagine if I'm in Dad's and I'm
well, mine's bigger. You can set up in it.
Yeah.
It's big.
Yeah. We have one that's really big now for those people who struggle a little bit.
Yeah, I've seen that. It's nice.
And I would say,
yeah. A family can get in. Right?
A whole family can get in. Yeah. And I would say that if you do have a little bit of, that anxiety, I think that's normal your first session. You don't really know what to anticipate. And so I think that's part of that anxiousness, right? You're enclosed, it's different. But generally people who are able to get through that and in there, this is going to sound terrible, but it almost becomes like this little safe, cozy space for them. And they love it. Yeah. And as a matter of fact, I like the smaller one because I feel like it's my own little place.
Safe place.
Yeah.
I think a lot of that was a mental thing. I mean, I think all of that's a mental thing. Not that I accuse anybody of having an issue with that, because it was real to me in that moment. But I think I didn't think I could breathe because I was struggling to breathe for some reason. I don't know why, and then it got in my head, and so I panicked. And you know what happens when you panic?
Right. Yeah. Everything goes out the door.
That was all she wrote. But yeah. So that is an option. We have a larger unit. You could get in with your family, which might make you feel a lot more comfortable if you are afraid of tight spaces. You can utilize essential oils in there to help calm you down.
Oh, yeah, absolutely. We have essential oils on hand that we do use to help people with ear issues. I mean, we do that.
Okay.
Yeah.
Okay, that's good to know. So, well, this has been a fun conversation. I was so glad I could get my dad out here. I knew that would be a stretch, but we got him to come and join us. So I love hearing about what he's done, and I love seeing that he's feeling better. And of course, it's always a pleasure to have Dr. Steph Coxon join us. She's a wealth of information, and not only do you have O2 Hyperbarics, you have a whole wellness practice. So maybe tell our listeners about some of the other things you offer, and we'll make sure we put in the show notes all the ways to get in contact with you to, because I think you guys do things remotely too. So even if they're not in our local area.
Oh yeah, we can consult over the phone and stuff. But yeah, we do things like pulsed electromagnetic field therapy. We do something called soft wave, which is where we take that magnetic therapy plus like a shock wave, and that induces a stem cell response. We do ionic foot baths. We do IVs. There's a whole host of things that we do on site. We even have a machine that helps to clear the lymphatic system, which is kind of wild. Yeah, it doesn't feel like anything, but it feels amazing. If you have a backed up lymphatic system, it feels amazing. Other people can't feel it, but those people, they can feel it.
Yeah.
So yeah, we have a whole host of therapies that are just designed to get your body functioning like it's supposed to function.
Oh, that's amazing. And you have a new little cafe in there.
Yes.
I cannot wait to come visit.
Yeah, so we have an organic cafe for, because a lot of times we're telling people, oh, don't eat this, don't eat this. And so what we've done is we have a gluten-free, dairy-free, refined sugar-free cafe that people can see you can have good food. It's, it's organic. It can taste good. It tastes normal. It's awesome. And so it kind of builds a bridge to understanding that you can eat, you can eat the fun foods and not damage your body at the same time. Because really that's the key. You don't need to give up everything. You just need to learn how to incorporate it appropriately so that you can enjoy life longer and with those right foods.
Yeah. And so your wellness center, is it Aruka?
Aruka Wellness Center, and there is arukawellnesscenter.com you can go to, and that's the building, because inside the building we have cranial sacral therapists, we have a chiropractor, massage therapist. So there's a whole host of practitioners underneath that building that are there all on the same page trying to get people healthy.
Yeah. And then what is your cafe called? Is it
Sprigs and Blooms?
Sprigs and Blooms?
Yes,
That's so cute.
little flower with everything. I just want it to be kind of earthy and natural and,
Cafes are my favorite places to go. Like the coffees and the teas and then that good food that
Yeah.
I actually eat. Oh, that's amazing. So, well, thank you for all you do to teach us health and wellness and inspire us and just help us break it down and understand it. And thank you, Dad, for being here.
Yeah, we're welcome.
So thank you for listening all about hyperbaric chambers and their benefits, and we will see you on the next episode.